Welcome to this unit on ethical, transparent design. By the end of this unit, you will be able to outline approaches for inclusivity in AI design, summarize the recommendations for ethical AI design. Ethical AI design. Technology designers and developers play critical roles in designing AI tools for use in health. However, unlike healthcare workers, in the AI field there are no requirements for formal qualifications in ethics. New approaches to software engineering are moving beyond an appeal to values such as reproducibility, transparency, fairness, and human dignity. Methods for designing AI technologies that include moral values in health have been proposed to support effective, systematic, transparent integration of ethical values. Ethical design values have also been built into legislation. For example, the EU GDPR includes specific obligations to include privacy by design and by default. One approach to integrating ethics and human rights standards is design for values. This means basing designs on the values of human dignity, freedom, equality, and solidarity, and for construing them as non-functional requirements. This requires a process-oriented approach that satisfies stakeholder needs in conformity with the moral and social values embodied by human rights. Ethical design can also be applied to the socio-technical systems in which algorithms are developed. These systems comprise the ensemble of software, data, methods, procedure, personnel, protocols, laws, norms, and institutional frameworks. All are brought together to ensure that products and services provide ethical outcomes for society and its healthcare systems. More generally, ethical and transparent design of AI technologies should be ensured by prioritizing inclusivity in processes and methods. Consideration of inclusivity when designing and developing an AI technology can overcome barriers to equitable use of the technology in health associated with geography, gender, age, culture, religion, or language. Approaches for promoting inclusivity. 3 approaches for promoting inclusivity in AI design are citizen science, open source software, increased diversity. Let's look at these in more detail. Citizen science is defined by the Alan Turing Institute as the direct contribution of non-professional scientists to scientific research, for example by providing data or performing tasks. Citizen science helps the public to understand a particular technology that may affect them personally, involves the public in research, discussions, and tool building. This ensures respectful co-creation of AI technologies that reduces the distance between the researcher or programmer and the individuals who the technology is intended to serve. Transparency and participation in AI design can be increased by the use of open source software. Open source software is open to both contributions and feedback, which allows users to understand how the system works, identify potential issues, extend and adapt the software. Too often, efforts to increase the diversity of AI technologies involve increasing the diversity of the data on which they are based. Although this is necessary, it is not always sufficient and can amplify any biases inherent in the design. Minimizing and identifying potential biases requires the involvement of people throughout the software development process who are familiar with the nature of potential biases, contexts, and regulations. To address this, the Institute of Electrical and Electronics Engineers have developed an AI ethics certificate for those working with AI, as well as ethically aligned design guidelines to ensure every stakeholder involved in the design and development of autonomous and intelligent systems is educated, trained, and empowered to prioritize ethical considerations so that these technologies are advanced for the benefit of humanity. Building values into AI. Software toolkits can be useful for providing concrete guidance to engineers who wish to integrate ethical considerations into the technology design. Software developer kits can provide guidelines that include a code of ethics, specific guidelines for health. Such kits could indicate, for example, how to manage data, including collection, de-identification and aggregation, and how to safeguard the destination of data. Kits have also been developed to facilitate certain ethical and legal requirements, such as the SAGE BioNetworks toolkit for the elements of informed consent. This toolkit provides use cases to explain its approach to informed consent, including e-consent. Examples of how it should be put into practice. A checklist to ensure that programmers have considered all the necessary questions and additional resources. With the increasing use of AI for health, more not-for-profit AI developers would be beneficial, as these developers are not constrained by internal or external revenue targets, can adhere to ethical principles and values more readily than private developers. Not-for-profit developers may include treatment providers, hospital systems, and charities. It is hoped that not-for-profit AI developers could emulate the partnerships that have been formed in the development of new medicines, diagnostics, and vaccines. These not-for-profit partnerships between the public and private sectors often focus on neglected populations while ensuring affordability and access to all. Similarly, a not-for-profit developer could address all areas of health, but particularly areas of neglect, while ensuring that their technologies adhere to ethical values such as privacy, transparency, and avoidance of bias. Predictive analysis. The use of AI for prognosis can allow assessment of the relative risk of disease and predict illness. There are, however, several risks and challenges with the use of predictive analytics, including concern about the accuracy of the predictions. Prediction of a negative outcome could affect an individual's autonomy and well-being. In public health, predictive analytics can forecast major health events, including outbreaks, before they occur. For example, before the COVID-19 pandemic, WHO was developing EpiBrain, a global platform that will allow experts in data and public health to analyze large data sets for use in emergency preparedness and response. It would allow forecasting and early detection of threats of infection, their impact, and insights to improve coordinated decision-making and response. Ethical, transparent design allows governments and international health agencies to encourage the development of AI technologies for predictive analytics, to assist and support decision-making by providers and policymakers. Predictive analysis technologies must adhere to ethical standards and human rights obligations, be open to improvements, be available for adaptation and use by governments and providers on a non-exclusive basis. WHO recommendations for ethical design. WHO recommendations for ethical AI design for health are 1. Meaningfully engage users and stakeholders early in the design process. Ethical considerations should inform design. 2. Design AI systems to improve health system and patient interests. 3. Ensure stakeholders understand the task the AI system is designed to perform and under what conditions. 4. Apply design for values and consensus principles. 5. Training should be available to designers and developers to ensure that they integrate evolving ethical considerations into design processes, including human rights. Download the reading materials for this unit for more details. You have now completed Unit 1 of Module 5, Building an Ethical Approach to the Use of AI for Health. In the next unit, we will look at how to engage the public, providers, and patients.